My name's Jessica. I'm going to be your nurse today. How did you sleep?
Not very well. I kind of kept having these like really, really, really weird, like disturbing dreams, and I remember my surgery and everything like that, and I kept having dreams about it, and it was really, really stressful.
You remember like your knee surgery that you just had? What was that, yesterday?
Yeah, I think I remember. I think at one point I like woke up during it and can like remember some of the things that were happening, and I didn't really tell my nurse yesterday because I was just kind of, still coming off the anesthesia and everything, but then I kept having dreams about it, and so I thought I should tell you guys.
Oh, okay. Well, that sounds really scary. I'm really sorry that that happened to you. Um, so what, just to kind of explain, I guess, what's happening, what it sounds like is happening. So there's a thing called anesthesia awareness,
Mhm.
and it kind of is sort of exactly what you're describing. Patients can sometimes feel that it kind of can range from anything from sort of like fleeting consciousness, kind of half awake, half asleep, all the way to like actually like remembering it.
Mhm.
Um, and there's kind of a lot of different things that can cause it. So, do you smoke?
No.
Okay. Do you have you ever have you been a long-term user of alcohol
No, not really.
or opioids or amphetamines?
I've been on oxycodone for quite a while now just because of like the arthritis and everything really hurts. So I've been on that for at least a few years, I think,
Yeah.
probably more, but yeah.
Okay. Yeah, so sometimes like opioid use, like long-term opiate use especially, it can sometimes increase the anesthetic dose that's needed to produce like the same level of unconsciousness as other patients.
Mhm.
And so
Okay.
since it's and this is your first surgery,
Mhm.
yeah, so sometimes it's a little bit difficult if we don't have like a surgical history review because we don't exactly know how you'll respond to the anesthesia. So it's pretty possible that because of that and maybe some other things, um that yeah, you weren't I guess like totally unconscious because you said that you woke up. So yeah, I'm really sorry that that happened to you and that you're having bad dreams. Um Something that can sometimes happen to people after they experience something like this is that those bad dreams can persist and cause a
Mhm.
lot of anxiety, um, and sort of PTSD really. And so if you feel like that is happening to you, like please reach out to us and we can definitely get you the help that you need because that is not something that we want you to go through alone. um,
Okay.
yeah, there's psych consults and there's therapy and things that you can go through if you feel like this is like really affecting your life after the fact.
Mhm.
Yeah, and we like now since we know that, I'm going to talk to your surgical team because they like to know when things like this happen. So I'll talk to your surgical team.
Mhm.
They'll probably want to talk to you. I'm going to tell your physician too, just so everybody knows what's going on. And then we're going to leave a detailed record in your medical files that this happened. So that way, if you ever need surgery in the future, they're going to know that this has happened to you
Okay.
and that you might need like a little bit higher dose of anesthesia. So you be sure too, if there's ever another procedure in the future, to tell your providers that this is
Okay.
something that's happened to you and there's records of it and it's something that obviously we don't ever want to happen
Mhm.
again.
Mhm.
So yeah, I again I'm just really sorry that that happened to you. I can't imagine that that is a fun thing to go through.
No.
Yeah. um so do you have any other further questions for me about that?
Yeah, would you suggest that maybe I get a consult with a psychologist just to make sure that like I know how to deal with the dreams early on so I don't develop any psychological disorders?
Yeah, absolutely. We can definitely set that up for you if that's something that you're interested in. I would recommend that because
Mhm.
it's easier to get in front of sort of in the beginning than after you start having problems.
Yeah.
So, yeah, I can definitely set that up for you. We can call them up here today and they can come talk to you and you can just kind of retell them everything that's happening and they'll
Mhm.
probably going to want to know some maybe more like details about your dream.
Mhm.
So, after that, yeah, yeah, you can talk to them about it, and then they can kind of help you find some coping mechanisms and things like that, so that the anxiety and I don't know if it's causing you like insomnia, but to stop that from happening, or if that is already happening, to sort of think of some ways to stop that.
Okay. Yeah, that'd be nice.
Yeah, perfect. So I will set that up for you.
Okay.
Yeah, and then we can kind of go from there. Do you have any other questions?
Nope.
Well, thank you for telling us, because I mean, sometimes a lot of patients don't feel comfortable saying that because they think that that's not possible. And unfortunately, it
Mhm.
is possible. And we try really
Mhm.
hard to make sure that that stuff never happens. But, it's just really hard for patients who have never been under anesthesia before to kind of know exactly what's going to happen. So I just
Mhm.
appreciate you reaching out and feeling comfortable enough to tell us that.
Yeah, thank you.
Yeah, you bet. So if you don't have any other questions, I'll come back and check on you in a bit. If you don't need anything else right now.
Nope,
No?
I'm okay.
All right, perfect. Well, I'll see you in a little bit then.
All right.
All right, thanks.
Thanks.
Okay, so now I'm out of the patient's room, and what I'm going to do is go set up a site consult, talk to the surgical team and make sure they know what's happening. And then I'm going to call the hospital lawyer and inform them that this happened, because a lot of patients will sometimes sue over this for like mental distress and things like that. So that is what I'm going to go do right now.